The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Welcome. I am Tony Urbanic, and we are here for the next installment episode of TMD Demystified. Today's topic and title is entitled, Experience, the Most Important Factor in Treating TMJ Successfully. I'll just repeat that for a moment. Experience is the most important factor in treating TMJ successfully. And I believe that to be true. The reason we are going to discuss that is because over the past 13 years, aggressively daily treating TMD non-surgically, I have come to the conclusion that the experience that one has just about everything to do with treating the patient. Now, let me explain. First of all, let's try to give you a little basic on what I'll be talking about, and then I'll make it clear, because obviously on first blush, I think every listener or person viewing this would think that the doctor's experience treating TMD, in other words, the number of cases, number of patients, the amount of time that he has spent treating TMD is the most important thing. That is not what I'm referring to necessarily. Now, it is true that portion, the amount of time you spend treating a patient or studying a problem, gaining experience is important, but that is not what I'm going to be discussing today. And so if you allow me to, I would like to unpack this and describe it for you and define it for you in detail. And I have a major point to make at the end that I would like to share with you, and it applies not only to treating TMD, but it applies to almost every type of healthcare provider or even non-healthcare providers who provide services to people. And that is a large group of providers and a large group of people. And so there's something to be learned here today that I'd like to share with you. So first of all, let me define experience according to the dictionary, so we can have that firmly at hand. And we'll discuss it to make this point. So actually, experience has two major definitions. Some words have more than one definition. This is one of them. Only two, though. Only two. Number one, experience is the direct observation of or participation in events as a basis of knowledge. So your direct observation or participation is experience. And then definition two, just reading these right out of dictionary. Number two, the fact or state of having been affected by the gained knowledge through direct observation and participation. So definition two is actually the effect of the experience one has had by the gained knowledge through direct observation and participation. Now, how does this apply to treating TMD patients? So I could spend the entire day giving examples of how this could apply to salesmanship and people who provide other services to folks. But in this case, we just want to limit it, trying to help you, the viewer, the listener, to gain knowledge so that you could treat your patients in your practice better. All right, so those are the two definitions. Now, who do they apply to? That is the first question. The first question to ask about experience is, whose experience are we asking about? Is the experience of the doctor or the experience of the patient? The answer is both. I am going to be discussing the experience of both the doctor and the patient as it relates to TMD. And the experience of the doctor and the patient actually is the most important factor in treating TMD, TMJ. Now, those experiences are quite different between the doctor and the patient, the healthcare provider and the patient. They're quite different, but each of them has a significant level of importance in coming out with a successful treatment. So let's kind of describe this point by point, person by person. The doctor's experience in treating, his direct observation is based on, regarding TMD, his direct observation is based on what he has been, what he has seen with patients, or it could, in his interface with patients who claim to have TMD or been told they have TMD, and he has observed these kinds of things directly with the patient. He can also include his experience in a learning environment, his direct observation in a learning environment, in a classroom, and reading text, his direct observation about reading a textbook or going to a meeting or scholarly activity. That is his direct observation and participation and his experience, definition 1. And then the doctor will also have definition 2 applied to him, which would be how that affects him. And then how that affects him has to do with how he carries on afterwards. The effect of that education, that effect of the experience with multiple patients in his practice, whether they be positive or negative, good or bad, reinforcing or unreinforcing, it can be quite different. And then the effect of experience, which is, I believe, and this is a major point I want to make, just as important as the experience of the doctor in getting a successful solution, because that's where we're leading. We want successful solutions. And the patient's experience regarding TMD, definition 1 and definition 2, are equally, I believe, equally important on coming up with a successful solution, a successful outcome to treatment of TMD. So in the patient's point of view, they have direct experience to gain knowledge by what they observe. Well, what do they observe? They observe, most importantly, most directly, they experience their symptoms. And their symptoms, actually, as we've talked so many times before, are so various, unexplained in the patient's mind. They are not medically oriented. You don't expect them to be medical oriented, but they experience the symptoms. And they experience all of the symptoms, but quite frequently, in fact, almost always, they think that some of those symptoms are not related to the temporomandibular joint. They are related to something else going on in the body other than the temporomandibular joint. They may relate jaw pain or ear pain or pain here on the side of the head. Very frequently, we see that frequent and recurring headaches that have been diagnosed by others as migraines is not brought into their view as being a particular symptom associated with temporomandibular joint disease. Certainly not upper back and shoulder pain, arm, hand, finger tingling and numbness, Rarely ringing fullness and dizziness of the ears are considered by patients as symptoms of TMD, although they are experiencing these symptoms, definition one, by direct observation and participation. So they have experiences, but they have incomplete knowledge most frequently on like where they're coming from. And then definition two, as it applies to the patient, would be how that affects them, the effect of that, and what patients perceive or what they think or their bias about their symptoms and prior knowledge. They may have had direct experience with a family member who also has the problem. They may have direct experience with something that they read on Dr. Google, which is very, very common nowadays. They may have direct experience by asking a neighbor what they think or about the problem or the symptoms that they're having. They're incomplete number of symptoms, but they're getting this direct experience, and then that by definition two, how that affects them. And each one of those definitions has a large part to play on the final outcome when you now mix the two, that is the healthcare provider, the doctor, and the patient, and you mix their experiences because they don't match. The experience of the doctor and the experience of the patient don't frequently match. Now, they can match, or they can totally be unmatched, or variations of some match and some not match. But generally speaking, the experience of the doctor and the experience of the patient, they don't match. So if you have two people who are involved, intimately involved with solving a problem called TMD, the best way to get a successful outcome is to match their experiences as much as possible so that there is shared knowledge, and shared knowledge develops understanding. Let me repeat that again, because that is at the heart of what I'm trying to tell you, what I'm trying to teach here, because I have so many questions. I field so many questions from our doctors in the network. Is they understand how the device works. They understand the metrics of it. They understand the protocol. It makes sense to them how it works. Where they have problems, where the current doctors in our network who provide non-surgical TMJ service using the Urbanic device and protocol, I field questions all the time, texts and calls, and it's like they have a problem with the patient, getting the patient in on enough knowledge so that they have a match of experiences and a match of understanding. And that is what I'm trying to describe, and that is what I'm trying to give you a reasonable solution for, and how to handle that. So basically, that is the description of the problem, and that is experience is the most important factor, but the experience has to be similar. Now, in 2024, actually, today's date is June 25th, 2024. The general consensus about TMD throughout the United States of America and beyond, because I have significant experience in discussing this with healthcare providers throughout the world, but especially the United States. The consensus is that when it comes to TMJ, TMD, nothing works. It's a conundrum, it's a catastrophe, it's a confusion. Nobody knows what to do. That's the consensus. Now, there are pockets of doctors who claim they can do this or they can do that, or they have this solution or that solution, or use Botox or use drugs. We just covered that so thoroughly in past episodes. But I am not speaking directly to the outliers on the bell curve. The bell curve, it has two tails. There are outliers, but the majority in the standard deviations, the middle of that bell curve, the consensus is among doctors and patients is that nothing works. Now, we have proven that to be false. We have proven that with independent university studies. We have proven that with treating directly out of this single practice here in Brentwood, Tennessee, over 4,000 people successfully non-surgically. But that isn't to brag. That is just to say that that goes against the consensus. And so to start knocking down these biases that nothing works, you have to go through a little teaching process. So the patient's experience and the doctor's experience need to be similar. Now, their experiences nowadays, generally speaking, because the consensus was formed on a bunch of bad experiences, multi-professional programs that put multiple doctors together trying to solve, these symptoms treating the symptoms, but not the cause. I've discussed that on a previous episode. Multiple things that only work for a short period of time, like non-steroidal pain medication, aspirin, those non-steroidal medications work really well for 2 or 3 weeks, but they're very short term. And then there are, the doctors who just claim ignorance. They don't know anything about it actually, or they claim not to know anything about it. But from everyone's point of view, those are not good experiences. Those are not good experiences from the doctors and not good experiences from the patient. And what we're looking for is good experiences that counteract the bad experiences, that bring patients and doctors together so that they can share their knowledge, whether it be patient kind of knowledge or doctor kind of knowledge, so that there's enough interface and cooperation that not only the knowledge is shared, but there's understanding. And once you get understanding between the doctor and the patient about this problem, then you can apply the solution. And the solution is very simple. I'll just repeat it again. The solution is to decrease the inflammation within the temporomandibular joint by unloading the temporomandibular joint, with a device that is no more complicated than a set of crutches unloading a damaged knee, or a splint unloading a damaged elbow with tennis elbow, unloading the joint, allowing the inflammation to decrease adequately and over a long enough period of time, when the symptoms then disappear. That's the simplicity of this. And that is done easily by this device, applying a protocol. You have to be able to use the device at the beginning 24/7 to unload the posterior teeth. Posterior teeth supply most of the forces on the temporomandibular joint, 90% of the forces. You unload the posterior teeth so that they can't occlude according to a protocol long enough to allow the inflammation in the joint to die down, just like a set of crutches would allow the inflammation in the knee to die down, or a splint on the elbow to allow the inflammation to die down enough so that the symptoms of tennis elbow or knee inflammation go away. So how do you achieve this activity where both patients and doctors share their knowledge? Well, that's generally speaking very simple. You have to speak openly. You have to share your knowledge. Both the patient, and this is again, second key element. Not only does the doctor have to share directly his knowledge about this problem, with the patient. The patient has to share their knowledge about the problem with the doctor, including any biases they might have heard or know of or are aware of. So, but you have to share your knowledge, hopefully share it in a way that's truthful and to alleviate as many biases as you can, and just share your knowledge. A good example about that, after treating, again, well over 4,000 people, it really works best in our office, patients with me, when I get the patients to talk about not only their symptoms, but I get them to talk about what they think about their symptoms, their experiences, even their bad experience with other providers. It isn't a matter of allowing them to get it off their chest. That is not what you're trying to do. You're trying to basically just get in communication with that person to the point where they understand, or they think, they have the idea that you, the provider, knows what they're talking about, that they understand, you understand what they're saying about their symptoms, about their previous experience, and your back and forth comment or discussion about that. On the other hand, the doctor needs to talk about his experience, which is gained through treatment of other patients, definition, the most common concept, how many patients have I seen, but it's not the only thing. It's like, well, what has been my experience with certain symptoms? What has been my experience as the doctor with these other treatments that the patient has experienced that have not been effective, or they would not be sitting in your office. All right, so you have to look at it like this. You can't just take a device with a protocol, slap it in the patient's mouth, tell them it's going to work, or tell them I hope it's going to work, or tell them I think it's going to work, send them out the door and say, come back in a certain amount of time. That is not going to lead to the most successful outcome if you do that. And that's what I'm trying to describe here. But experience is the most important factor in a successful outcome, and it's shared experiences between the patient and the doctor. Shared experiences. The patient has certain direct experiences by their participation. Some of them great. Some of them have 20, 30, 40 years of experience on these symptoms, and 20, 30, 40 years of experience with trying to talk to other healthcare providers and doctors about, what can you do? Can you help me? What is this going on? I don't understand it. These symptoms, they don't go away. They keep coming back. And the doctor himself sharing what he knows about the mechanics of it, the mechanics, explaining to the patient that it really is very simple. It's all about inflammation in the joint. To take a little time to explain to the patient in terms that they can understand it, because that's what we're after, understanding how the inflammatory cycle works, on and off, up and down the inflammatory cycle. That's why the symptom cycle comes up and go. Why the inflammation within the joint, the mechanics, the anatomy, the pathophysiology. How can inflammation in this joint cause me to be dizzy? How come it can cause me to make it feel like my ear's full of water? Why does it cause ringing in my ears? Well, give them a little insight in that the petrotympanic fissure, which allows inflammation into the middle ear, is that far away from the middle ear and connecting the temporomandibular joint to the middle ear, allowing inflammation again. Taking the time to do that with the patient so that you can share your experience, shared experience, to develop knowledge leading to understanding. When two people, and now again, I'll repeat, whether you're talking about trying to get somebody to accept treatment for TMD, or their crown, or their bridge, or their dental implant. This applies to all of those in dentistry. It applies to family problems, getting two opposing experiences to the point where you share your knowledge closer and closer, so that you share your experiences to gain knowledge, and then you get understanding. Well, in a professional viewpoint in your practice, as it applies to dental implants and crowns, it works the same way. And as you share that your experiences, professional experiences of various kinds, and patient experiences of special kinds, and understanding that those experiences have different effects. That's effects, AFF, effects on patients, and they have these different biases that are created by the effects, and so does the doctor. But as you begin to share this information together in communication, in discussion, you finally gain shared experiences, shared knowledge, and get to understanding. And when you get to that point of understanding, the patient is going to want the service. The patient is going to expect the service. The patient is going to demand the service, because now they understand. You're not selling anything. You are just bringing the patient to understanding, and using your experience and their experience to eventually come together, acknowledge their experience. You'll learn so much from our point of view, from the doctor's point of view, by just allowing the patient to give you their experience. And again, I've said many times, some people want to go on for an hour and talk about it. You may not have that much time, but as much time as you possibly can squeak out of your busy schedule to gain those experiences from the patient. And that way you will have the ability, not only your experience, and of course, how many patients have you seen? I have seen 4,000 successfully treated patients. That's a nice, that's a nice feather in your cap. But that isn't the experience I'm talking about. It's your experience on all levels of treating this problem, and the patient's experience on all levels of having this problem, and what other experiences they've had in trying to learn about what's going on. But as you share your experiences, you come closer together. When you get to that point of understanding, the battle is won, and they will accept treatment. And it's a lot more fun that way. It's a lot easier that way. And when you have once they accept treatment, then it's just a matter of a little bit of time. The symptoms start to come down, and sooner or later they will come in and they will hold this thing in their hand, and they will say, quote, "I would never believe that this little piece of plastic made all my symptoms go away." Or resin. This one's resin rather than acrylic. Or, "This thing saved my life." And we hear that in this practice. Those two statements we hear almost daily, but definitely weekly. One or more patients make those statements. "This thing saved my life," or "I would never have believed that this little piece of plastic would make all my symptoms go away." That is a fact. If you would like to learn more about how to treat patients successfully using a very simple concept and thing that is now patented, FDA cleared, university attested, university successfully studied, with success rates in the 90%, you can contact me personally, and I'll give you as much information as you need. I'm happy to talk to you. You can contact me at tony@tmjservices.net. Easiest way is just get on our website, www.urbanictmj.com. From there, you can learn so much more. You can see hundreds of patient success stories. You can register for our most current in-person seminar It's a all-day seminar, 8 to 4, with 6 CME credits. That is going to happen on July 26th, 2024 in Franklin, Tennessee at the Franklin Courtyard Hotel. Or you can actually take an online course and register for the online course and become licensed either way, in-person course or online course, be licensed to be a network provider for a patented device and protocol. With that being said, I really hope that you've taken the time to understand what I've tried to teach today learned by my experience with patients treating this problem. And if you take it to heart and you start practicing this literally practice on patients after patients, you'll find that treating these patients are a lot of fun. It's just really a hoot on many aspects because you get into really personal discussion with the patient. You learn so much about this problem because the patients will tell you so much about this disease that you did not really understand. And the best way to understand it is to listen to their experiences. That is how I came up with the solution, by listening to patients, not reading textbooks, not going to more seminars or conferences. The solution actually came by listening to my patients, which gave me the key to where to look. I looked there, it was successful. Then we had to figure out why it was successful. And then it was off to the races. That being said, I look forward to the next time, which will be on next Tuesday. I will deliver another episode of TMD Demystified. I am Tony Urbaniak.